whenever you're planning to have a kid, it's important that you come and inform us so that we can also run some tests on you. We check whether you are doing well. We take your blood counts, the viral load, and advise you on how to go about it so that you get a safe child, so that you do not pass the virus to the child. That would be great. Yeah, and you still have an opportunity to breastfeed the child.
Moja jioni, moja asubuhi, moja asubuhi, na moja jioni. Na meza sangani date. We'll come back on date 17th of December. Have a very nice time, but if you have any problem, just feel free to come back.
Okay.
Sawa sawa.
Thank you so much for your time. Yeah.
Despite all the gains that we've had in treatment in Kenya, we still have not reduced the new infections adequately. So we have this situation where we have an increasing number of people coming into and requiring treatment. So through new infections, we're having close to 100,000 new infections every single year within Kenya. And this number has to be reduced if we are going to be effective in our treatment efforts. Otherwise, we are going to be putting more and more people on treatment and we'll never reach the end.
What Kenya has done, it's one of the first countries that has developed what we call the Prevention Roadmap, where we look at where we are with regards to the epidemic and then look at the opportunities for prevention.
My main job is to create HIV awareness, distribute condom, and empower the community to take HIV tests, and also to update them on what is happening in the world of HIV. That's my main job. Per day, I distribute about 5,000 pieces of condom within the community. Because we are changing life, we are improving people's life. 70% of Kenyans don't know how to use condom, but they use condom. And we are getting HIV infection. Every year we are getting like 100,000 new infections in our country. We can't stop and wait for people to die. We have to go out and tell people the truth. Yeah.
We have an estimated population of 30,000 plus men who have sex with men in Kenya, 130,000 female sex workers in Kenya. And the young women who are at risk cannot even be quantified because we don't know how many of them are at risk because they're within the general population. So in this particular project, we are targeting 2,100 men who have sex with men, female sex workers, and young women who are at risk of HIV.
And question, how many men want to remove condom during the act? How many men request you? Condom. How many? Many. Or when a man hold the tip, be the one to roll down the condom. Can you roll down? Roll down. Why? This condom is getting inside you. You have to supervise that this condom is put on the right way.
But if you don't know me, you know about bar hostess. Who doesn't know about bar hostess?
My name is Beth, and I'm 25 years old. I've done sex work for the last 3 years. Sex is my day-to-day activity. That's hence it puts me into risk of getting HIV because every day I meet new clients every day.
Antiretroviral therapy, there are drugs which we give for 28 days, whereby you are supposed to take it consistently for 28 days.
What I want you to do is now test me, put me on PrEP.
In the cervix. When I'm talking about the cervix, you see this part, the lower part here. Yeah. So this is the opening to the uterus. Okay. So if you have any infection at this side, then you get...
Every day people get infected. And especially when it comes to sex workers, every day you'll find new girls coming on the street. Every day. So it is important for them to be given knowledge on prevention so that they don't get infected.
We told you one of the benefits which you had for VMMC, one would be to reduce the chances of getting HIV by 60%.
Since 2010, we have been able to reach a total of about 20,000 men with the service. And the service, the voluntary medical male circumcision in Eastern Deanery, is offered as a minimum package, which includes HIV testing and counseling, also includes risk reduction counseling, and then of course the actual procedure of voluntary medical male circumcision.
Kenya is one of the countries that I think among the top 4 countries that have made very good progress in scaling up male circumcision. And we are continuing to scale up. So we've made good progress, but we still have gaps. We still have areas which are traditionally non-circumcising communities. And those are the areas that we're putting focus on.
The government has shown exceptional leadership, especially for HIV prevention, by launching the Prevention Revolution Roadmap. The government has shown us that we are going to have to prioritize HIV prevention for us to be effective. And the Prevention Revolution Roadmap is a document that is really futuristic in its look. It targets the people who need HIV prevention the most.